and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. Even young adults these days are suffering from sudden cardiac arrest due to a sedentary and stressful lifestyle, and without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving interventions passes. Now, it has been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that a majority of cardiac arrests take place at home. Now, Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who will answer all our questions and help you understand the role of CPR to revive and save a life. We're joined by Dr. A. Mathavan, interventional cardiologist, Dr. Madhavan Heart Center, Madurai, and Dr. B. Vinod Kumar, associate professor, consultant interventional cardiologist, Department of Cardiology, Sri Ramachandra University, Chennai. Thank you so much, doctors, for joining us on the program. Dr. Kumar, a heart attack is considered dangerous and fatal. Some people get a mild heart attack. Is a mild heart attack a kind of a warning sign? And what is the difference between a severe and a mild heart attack?
Yes, as you rightly pointed out, mild heart attack is a warning sign. And how we differentiate between a mild and a severe attack is depending upon the amount of damage to the blood heart muscles which is happening. For example, if the major artery supplying to the heart gets blocked, then there will be a significant drop in blood pressure. The area of muscles getting damaged will be very high. So the patient's blood pressure will drop down. Patients will have severe symptoms, will have ECG changes. Heart pumping will come down. This is a major type of heart attack. In minor type of heart attack, the branch vessels get occluded and the patient's muscle doesn't get wasted much. And the pumping is almost every time it is preserved. So these patients are better response to the treatment on initial stages. But we also should keep in mind that these patients further need further evaluation because it could be a warning sign. They might have blocks in other vessels which can lead to a major attack in the future. So any patient who has a mild attack should be completely evaluated if required by a coronary angiogram, and they have to be followed up with a cardiologist on a regular basis.
Right now, Dr. Kumar, many people die due to cardiac arrest during sleep without any major symptoms. So do people ignore mild symptoms or don't they get any warning at all? If you could explain this to us.
Yeah, of course. See, there is a study in Journal of American Heart Association, which is published in 2018, which claims sudden cardiac arrest happens among all the deaths. It's about put together 10 to 15%. Among the 10 to 15% of sudden cardiac arrest, 20% is death in the nocturnal period, that is during night hours. We should all understand the sudden cardiac arrest can occur while you are in exercising mode or in your rest or in your sleep, but the chances are more during the sleep. And usually it occurs to the patients who already have a heart disease or a genetic disorder or a family history of heart disease. And they need to be followed up very carefully. And this basically happens because of the electrical disturbance in the heart. And we all learned in the younger age that the heart has 4 chambers, 2 upper chamber, 2 lower chamber. Whenever there is an electrical disturbance in the lower chamber, and the abnormal beating of the lower chamber can lead to the cardiac arrest among the patients. And for example, other comorbid illness like, for example, sleep apnea among the patients, even that can cause heart rhythm variation leading to cardiac arrest. For example, a patient is a diabetic, long-term diabetic, elderly patient going in for a severe hypoglycemia might develop a cardiac arrhythmic event. So it is not unknown, but these patients are already diagnosed multiple complicated patients. Otherwise, if it is happening in a patient, it should be a genetic disorder when it happens in a very young age. That's how we see this issue of sudden cardiac arrest among the patients.
Right. Dr. Kumar, what are some of the most common risk factors then associated with cardiac disease in general and heart attack in particular?
Okay. To put it forward like this, diabetes is the major complication what we see. All we know is India is the major capital of diabetes in the world. So every 3 persons, I always tell my patients, if 3 persons are sitting in a room, if they are more than 30 years, then one should be a diabetic and one should be an hypertensive. Diabetes and hypertension forms the major backbone for all cardiac illness. Similarly, your elevated cholesterol levels, that also leads to a major problem with the heart disease. See, heart disease in general, what we mean is coronary artery disease. That is specifically we are talking about in large chunk about their heart attacks. So a patient who has a diabetes, hypertension, or a dyslipidemia, that is cholesterol high levels, they have a higher risk to have a heart attack when compared to that of a normal population. For example, if a patient is a diabetic and is uncontrolled, his chances of having a heart attack is more than 2 times than a normal patient. Similarly, if he has diabetes, hypertension, and one more risk event, the risk increases 7 folds than the normal patients. So it is always better to be diagnosed these ailments, comorbid illness, what we call at the earliest stage, and control them to effectively to prevent any cardiac event in the future.
Right. Dr. Mathavan, if you could tell us, globally, cardiac arrest claims more lives than colorectal cancer, breast cancer, prostate cancer, influenza, pneumonia, even auto accidents and HIV, firearms and house fires combined. Why are the chances of dying on the spot due to cardiac arrest more?
Because the heart has got 3 arteries to supply. If the heart attack happens, it is not like any other disease like cancer or any other infectious diseases. The moment the blood supply is cut off, the majority of the myocardium, that's a heart muscle, is deprived of blood supply, which leads to sudden cardiac arrest. This sudden cardiac arrest usually happens because of arrhythmia, that is very high heart rate, which is called ventricular fibrillation or ventricular tachycardia, sometimes because of very low heart rate like bradyarrhythmia and asystole. So this sudden cardiac arrest is a very important thing which takes lives immediately and without even giving time in some cases. So therefore, it is quite different from the other diseases like cancer or other infectious diseases. It's an instantaneous thing, and people are not aware of the symptoms, and most of the symptoms are very deceptive. So that's why the mortality is very high over these years, in the last two to three decades.
Right. Doctor, now people often undergo surgical treatment such as angioplasty or coronary artery bypass surgery to remove the blockage from the blood vessel and to restore blood flow to the heart. And they think once the heart surgery is done, then the problem is solved. What is the truth, if you could tell us? Yeah, Dr. Mathavan?
Yeah. Can you repeat the question?
I was asking that, people often undergo surgical treatment such as angioplasty or coronary artery bypass surgery. And once they have this operation, they think that, the problem gets resolved. So if you could explain whether, what is the truth in this matter? No,
it's not. It's a only temporary measure. What we are doing is we are just trying to, there is a block in the blood vessel of the heart. By angioplasty, we are just removing the clot. Or in bypass, we just connect with the, another bypass. So it is only temporary measure, which means you can go for another 1 decade or 2 decades, because the atherosclerosis, that is the lipids and cholesterol are forming in the arteries, that process going on. So you are not going to do anything unless you change your lifestyle, change with lifestyle and control your risk factors. So angioplasty or bypass surgery are temporary measure. Temporary in the sense it can extend your life for 10 years, 20 years, 30 years like that. But still, our lifestyle modification is very important to get the best out of these two procedures.
Right. Dr. Kumar, sudden cardiac arrest is an enormous healthcare challenge. It is also a condition that is commonly misunderstood. If you could tell our viewers how cardiac arrest is different from a heart attack.
Yes, of course, that is a very important thing everybody should know. See, what heart attack does mean is if there is a block of the blood vessel which is supplying the heart muscle for 100% or 80%, it is going for an occlusion. That particular area muscle gets down. They don't pump effectively. That is what we call it as a heart attack. But the other way, sudden cardiac arrest is the problem which we deal with the electrical issue. I always tell my students, if you have a problem with the heart, then you talk about two things. One is the plumbing, another one is the electrical activity. So if you have blocks in your pipe in your home, then it is heart attack. If you have an issue of short circuit in your home, then we are talking about sudden cardiac arrest. So these both are two different issues which deal on the heart. So when there is a heart attack is happening, there is a block in a blood vessel and the pumping is coming down, patient has chest pain, breathing difficulty, all sweating, all other symptoms, they go to rush to a hospital. But in what we are talking about a sudden cardiac arrest is, this is absolutely, as I said earlier, there is a rhythm abnormality which is happening at your lower chambers most probably. This, what happens is the heart rate goes haywire. It starts beating irregularly at a faster rate, does not allow the heart to fill effectively. So the blood supply to the heart and the other organs to the brain, everything comes down very suddenly. And as mentioned by Dr. Madhavan, it doesn't give us any time to resuscitate the patient. So patient suddenly going for a complete arrest of the heart. This is basically an electrical problem, whereas heart attack is a blood vessel problem. And you get time in most of the heart attacks to treat. Whereas in cardiac arrest, unless you do an emergency CPR, survival of a patient with a cardiac arrest is very, very less. Even a very well-developed country, European countries, the outside hospital cardiac arrest is about 30 to 40%. In countries like India, a lot of patients do not even reach hospital and they die because of sudden cardiac arrest. So these two are completely different entity and they have to be treated differently. For heart attacks, emergency department, treatment, all good. For a sudden cardiac arrest, CPR is must and it's going to be the lifesaver. As mentioned by you, a lot of times CPR properly done saves 50% of the patients. So that's how we have to see this issue.
All right, doctors, will slip into a short break, but don't go anywhere. We'll return with more questions for the doctors. Stay with us. Welcome back. You're watching Health and Wellness. We're talking about heart health. Well, let's go across to our panel of doctors to answer all our questions. Dr. Malesh, how does an automatic external defibrillator help a person who is in cardiac arrest?
Automatic external defibrillator recognizes the rhythm of a patient who has collapsed. Usually, the abnormal rhythm will be detected by automatic AED, and appropriate shock will be given so that the abnormal rhythm, what is called as defibrillation or ventricular fibrillation, will be converted to normal sinus rhythm so that the life will be restored immediately.
Right. Dr. Madhavan, can you explain please the things to keep in mind before one starts CPR? We're talking about CPR, but what should a bystander do before they actually start performing CPR on someone?
Suppose if you see a person on the roadside, out of the hospital victim, first you have to make sure that the patient has really a problem. So you have to first go near the patient, that is a casualty, and tap the person and hi, in whatever the language, the local language, and you have to ensure that the patient has has a problem. And once ensuring that the patient has a problem, you have to see the breathing pattern and pulse. If you don't see a patient is not breathing and there is no pulse, you have to see, even it can be done with non-medical professionals. They just need to see the windpipe and slide the finger along the windpipe and see whether the carotid pulse is felt or not. Once it is ensured that the patient has got no pulse and no breathing, make sure the patient is kept in a position that is a face-up position, and preferably not on the soft surface, maybe on a firm surface, so that the effective compressions that is given will be reaching to the heart. Otherwise, over the soft surface, if the patient is not, the victim is not kept in the soft surface, whatever the compressions that you give, it will just push the victim's body into the softer area. So these are the very important things that should be borne in mind before starting the CPR, that is a high quality CPR.
Right. Dr. Kumar, now there are also different types of CPR. Which CPR can be performed by an untrained person, if you can tell us?
Probably this will be the most important thing everybody should listen. See, because there are two types of CPR. One is by a trained person, one is by an untrained person. The American Heart Association clearly says that an untrained person can perform hands-only CPR. That means if you are not able to give a mouth-to-mouth breathing, that is okay. You have to just go near to the patient, as Madhavan sir explained earlier. We have to make sure everything is perfect and call for help. See, if you are a single person, just inform the medical facility first before starting a CPR. Once, then identify both the nipples of the patient and keep your hands in center of the chest with the hands extended. Your hands should be extended over the center part of the chest and start compressing. You should compress about 5 centimeter. Every compression should be about 5 centimeter depth, and you should allow the chest to recoil again back. Then compression. Compress, relieve, allow it to recoil. Compress. This should be continued about 100 to 120 times in a second. For example, for a second, we have to do 2 times. For a minute, it is about 100 to 120 times in a minute. And you should keep on continuously doing this till a medical help arrives or you are being available with an AED. So this helps the patient or the victim to maintain his circulation. So every time you give 1 or 2 minutes, then check his pulse. If the pulse is not there, repeat it again. So keep on doing this compression, chest compression. If you are trained in CPR, then it is a different thing. You have to give 30 chest compressions followed by 2 mouth-to-mouth breaths. When you are trying to give a mouth-to-mouth breath, you have to keep the head end elevated and the chest also up, and keep your mouth with the patient mouth or the victim's mouth and enclose it and give 2 breaths. First, we'll give a breath and check for chest expansion. If there is a good amount of chest expansion, repeat 1 more breath. Then go for another 30 cycles of CPR, that is chest compression, followed by 2 breaths. So if there are 2 persons, if you are doing 2 to 3 cycles, you will become really tired. You can exchange with the next person who is standing next to you. So the first thing is call for help. And if you are an untrained person, do only chest compressions, which is called hands-only CPR. You have to give about 100 to 120 chest compressions per minute, and you have to continue this till the medical help arrives. Thank you.
All right, Dr. Malesh, let's now talk about, people's health and heart health, and how much cholesterol should a person have every day per day, and which food products contain good cholesterol? Can people eat food containing good cholesterol in large amounts?
Yeah, people actually, without any risk factors like cardiac disease, diabetes, and hypertension, they can take around 300 milligrams of cholesterol every day. So that cholesterol is required in the body to for the preparation of the necessary hormones and various processes of the body. So a person without any risk factor can take 300 milligrams of cholesterol every day. Person with associated risk factors like dyslipidemia, hypertension, diabetes, and cardiac disease, they can take up to 200 milligrams of cholesterol per day. So in the form of fat or cholesterol, what we take, the polyunsaturated fats are the most good fats, or what you call it, good cholesterols, so that they can reduce the abnormal cholesterol or the bad cholesterol and maintain the normal cardiovascular system, or it prevents the clogging of the arteries, especially cardiovascular system. So polyunsaturated fat, food containing polyunsaturated fats like olive oils and the fat from the vegetable source are the important the source for the cholesterol, good cholesterol intake, or what we call it as good cholesterol food intakes.
Right, Dr. Madhavan, speaking again of health, if body weight is in control, does this mean a person's blood lipid levels would be normal and that he and she cannot get heart disease?
No, not necessarily. Obese persons are likely to have high cholesterol, but the contrary is not true. Even persons with normal body weight still can have dyslipidemia, that is high lipid abnormalities. So it's not that the lean persons will not get heart attacks due to high cholesterol, and obese, some muscular people they may not have dyslipidemia. On the other hand, obese people like apple obesity, so visceral obesity, they are likely to have high cholesterol and dyslipidemia.
All right, Dr. Kumar, is it true that foods rich in both soluble and insoluble fiber help reduce the risk of cardiovascular diseases and coronary heart disease?
Yes, of course, it is true. See, we have to see like this, how the mechanism of fibers helping us to prevent heart disease. So understand that, as you see, the fibers rich cereals, vegetables, which we consume daily, if you are in a balanced diet, if you increase the cereal quantity and vegetable quantity, it helps us to bring down your blood pressures. In any hypertensive patients, if he is consuming a good amount of fiber food, then the blood pressure will come down. Similarly, the LDL levels also comes down. Even the soluble fibers like oats, wood bran and flax seeds, these also help us to bring down both cholesterol levels, that is LDL levels, as well as the blood pressure. By this, in turn, they prevent cardiac events. As we are discussing in the beginning, the risk factors increases the chance of a person to have a heart disease. So by bringing down the blood pressure and the bad cholesterol, we are able to prevent cardiac events. So any balanced diet should contain a very good amount of fiber, and it is less expensive. It is part of our day-to-day life food structure in countries like India. So a good amount of intake of cereals and vegetables and pulses will prevent cardiac events for sure.
All right. Well, thank you so much, doctors, for sparing your time and answering all our questions on heart health and what to do in case of a heart attack. Thank you all for watching at home. I will slip into a short break. More news on the other side.